Making a formulation or developing a formulation is a mixture of different components, we call them co-formulants, that we combine with the active substance that gives the product all of the right properties that we need. So a big part of what we do is making some samples, some candidate products, and then evaluating them to see if they really fit all of the criteria. And that can be done partly through a manual process, which would be done in the lab, but we also use a lot of automated tools that help us really make a lot of samples in a very short space of time.
Really, I started working on this at the point where solatanol as a product is pretty much finalised. The work I've done on solatanol has involved a lot of electron microscopy and specifically scanning electron microscopy to illustrate to people the effects that the product has, because a lot of what it's doing is really hard to see because you're dealing with microscopic diseases, and hopefully if the product is used properly it's stopping the disease before it causes any damage. So it's actually controlling the disease before you can tell it's there by eye.
We work very closely with the microscopy team, understanding what's happening on the leaf surface and what happens to the droplets. Do they dry down quickly? So all of those things are important.
Because of the range of different diseases that solatanol can be used to protect crops against, I do look at quite a range of different diseases in order to show that. So we've looked at the brown rust in wheat, we've looked at septoria in wheat, which are two of the most important cereal crop diseases in Europe. And we've seen in all cases how well it works against those diseases.
Seeing solatanol as a product is a fantastic feeling because it's very easy now on a very large scale to see what it can achieve. In terms of when it's used by any grower, it's very evident what the end effect is.
It's really important to me that the work I do actually achieves something, and it's really nice to know that it's going out there to a wider audience to help explain how the product is working and to explain how the diseases are working as well. If you don't understand what the disease is doing, you're not going to understand the necessity of controlling it until it's too late.
Actually, the very first time I saw solatanol in the field, the outstanding result was something I'll never forget. You know, you didn't actually have to really get very close to the field trial to see how good it was. You could stand at the edge of the field and say, wow, this is a good product.